The abdominal exam is what we're going to do next. And with the abdominal exam, the order is a little bit different. You start with inspection, as you do all the other ones, but then you move to auscultation, then you percuss, and then you palpate. The biggest thing with inspection is making sure that you are able to visualize the entire abdomen. So you need to lift up clothing, keeping modesty at all times. And then patients may have waistbands that go up to the umbilicus where you'll need to lower them so that you're able to visualize all quadrants of the belly. And actually, you can use a gown or a sheet so that you are lowering and able to visualize everything. Okay. The abdomen is divided into 4 quadrants. So you have a horizontal line across the umbilicus and then a vertical line. This is right upper, left lower, right lower quadrant. The first step is going to be to inspect. So you want to get, again, down level with the abdomen to see if you see any abnormal masses or just to assess the contour of the belly. You're going to look to make sure that everywhere looks symmetric. You're going to look at the skin coloring, if there's any scars there. You're going to be also looking to see if there's any hernias. And how you can do this is have them lift their shoulders up and see if you see any protuberance when they're doing a crunch style movement. So you're looking during inspection for symmetry, contour, the skin for scars, you're looking for masses, and you're looking for hernias. So that covers inspection. Prior to palpating, you want to make sure you auscultate, because if you start palpating before auscultating, it can affect the bowel sounds. You should get used to starting in the same and moving in the same pattern. So start in the right upper quadrant, and you're going to want to listen for several seconds, a couple places in each quadrant. And you will use initially your diaphragm of the stethoscope, so the big part of the stethoscope. Once you've auscultated for bowel sounds, then you're going to want to auscultate for bruits. Again, when listening for bruits, you use the bell of the stethoscope. And you're going to listen for an abdominal aortic bruit. Then you're going to move out laterally from there to listen for the renal arteries to see if you hear a bruit there. Move further down to listen to the iliacs, and then all the way down again to listen to the femoral. We'll do that now. So listening for an abdominal aortic bruit. Go just lateral to that to listen to the renal arteries. Further down to listen to the iliacs. And make sure with the renal, the iliacs, and the femorals that you're listening on both sides. And then to auscultate for the femorals, ask your patient to help raise the waistband so that you can palpate for the femoral artery and then place the bell right on top of it. Side. And that's it for auscultation. After you've completed auscultation, you can then start percussion. Percussion again is going to be done in the same pattern. You're going to start in the right upper quadrant, and this is a wrist sort of movement and tapping on your finger. So you want to have your middle finger pressed up against the abdomen, and then with your other middle finger, you're going to do a tapping motion over the abdomen. In the right upper quadrant, you have the liver. So in the right upper quadrant is typically going to sound duller because you've got a liver right there. So you have an organ right underneath it. Typically, if you get somebody right after lunch, you may not hear such a tympanic sound of the stomach. But you can hear the difference. Mm-hmm. Can you hear that? I shouldn't have done that. That was like...
Yeah, I can hear it great.
Because I'm trying to get right. Will you pull this down? After percussion of the abdomen in all four quadrants, then you're going to start palpation. Palpation, you should do both light and deep palpation. With light palpation, the legs can either be bent or stay straight on the table. And light palpation is exactly that. With just one hand, you're going to lightly palpate the abdomen in all four quadrants. Here, you're just feeling for any superficial masses or tenderness that might be there. With deeper palpation, ask the patient to bend their knees, and then using both hands, you're going to press one hand or lie one hand up along the abdomen, and then you're going to push with your upper hand, with the hand on top. And here you're really trying to feel what's underneath. It's not really a kneading motion, it's just more of a trying to feel deeper down to see what organs you might be able to palpate, or if you might be able to elicit any tenderness or guarding. And you want to move slowly and methodically through each quadrant. Deep palpation shouldn't hurt, but it is a little bit uncomfortable because you're applying a little bit more pressure. The liver is located in the right upper quadrant, and so to palpate the liver, you can do two methods. You can do the hook method, which is coming from up here and hooking underneath the ribs. And what you're going to do here is hook and push down. Ask the patient to take a deep breath as you're pushing up. And what you're trying to do is to push your fingertips upward, and as they inspire, their liver is coming down to touch the tip of your fingers. Okay? Girls should have their fingernails cut short so as to not hurt the patient. The bimanual technique that I actually prefer is to come from this angle and to push down underneath the ribs, have the patient again inspire as you're pushing upward. And again, as they inspire, the liver comes down and you touch the tip of the liver with your fingertips. This is this should be a little bit more uncomfortable for the patient than just the deep palpation, because you've got to push and put some weight behind it to be able to feel the liver. After you've palpated for the liver, you're going to palpate for the abdominal aorta, which you have already auscultated for, and is just a couple inches above the umbilicus. And you can locate it by palpating or feeling for the pulse, and then going on either side and trying to locate the width of the abdominal aorta. And in somebody that's older, you might get a bigger width. To complete the GI exam, you're going to test to see if there's any tenderness in the costovertebral angles. You're going to tap very lightly the CVA to see if there is any tenderness in this area. Two methods can be used, which is directly just tapping, or placing your fist up against the patient's back and tapping this way. You don't want to tap too hard, and if there is any tenderness due to an infection of the kidneys, pyelonephritis, the patient will jump off the table.